Hi, my name is Keely Gallagher, and as said, I am the Community Health Coordinator at Advocate Good Shepherd Hospital. Before that, I did work at a local health department, and I have about 15 years of experience in community health. So what is community health? I can tell you that when I ask people what community health is, I hear about flu shot clinics or COVID-19 testing or going to a health resource fair and getting a bunch of free stuff, which is great, and it is a small part of what we do in community health. But community health has really changed and evolved over the last several decades and had much more of a focus on health equity and addressing social influences in the community and looking at root cause issues of health. And we're in an interesting time right now because looking at coming out of COVID-19 and out of this pandemic, there's been so much more of a focus on community health. But it's also highlighted disparities of health within populations and given us a really great opportunity to talk about what health equity is. And so that is why I chose that for my talk this evening. So starting out, what is health? What's the baseline? Health is a state of complete physical, social, and mental well-being, and not merely the absence of disease. This is the World Health Organization definition. It's the one I've seen most widely used for health definition. I will point out that it does not include spiritual and cultural health, and a lot of other health definitions do, and I think those are extremely important to note. So then what is health equity? Health equity is achieved when no one person is disadvantaged from achieving their full health potential because of social position and social determinants of health. So what are some of the examples of then health equity? It is your life expectancy. It is the quality of that life. It is rates of disease. It can be disabilities. And when I say disabilities, I'm not just looking at what is the rate of a disability within a population, but are those disabilities being addressed? Also mortality rates. Severity of disease and access to treatment. So like disabilities, is there just a high rate of disease or are we actually treating those diseases? And this whole list that I just went through, that's not just individuals, it's also a zip code. What is the life expectancy of this person, but also what's the average life expectancy in the zip code? Looking at disparities in other populations, what's the life expectancy for Hispanics in the United States versus the white population, or males versus females? So really dissecting what that looks like. And I will tell you that when we look at health and equities, most of the time it's racial and ethnic minority groups that are disproportionately affected. And COVID-19 is the perfect example, unfortunately, but when you look at the COVID-19 pandemic and who was affected by, you can look at case rates, mortality rates, socioeconomic factors on who took on the biggest burden of COVID-19. You will see that it was people of color, it was lower income individuals, it is households with lower education, those that are food insecure, those that live in crowded housing, examples like those. And so another thing that I always like to point out when I talk about equity is what the differences are with equality and equity. So a lot of times the knee-jerk reaction when we see any kind of disparity is immediately to go, well, we need to make things equal. We want equality. And that makes complete sense that that's what you would want to do. But having that, just making things equal, is not always what works out, unfortunately. And I do have a graphic that you'll see now, and it is from the CDC, and it's one that I always like to include when I discuss any kind of equity. And that is, so on the top, you will see everyone received a bike to be on the path of health. We made it equal, everyone gets a fair bike, it's all the same, but you will see in the graphic that the first person in the wheelchair can't even get on the bike to ride. And the second person is completely hunched over, knees up, can barely ride. The third person is able to ride the bike, but the child can't even reach the pedals. So the equality, one size fits all, did not work. But when we looked at equity and everyone got exactly what they needed for their individual needs, everyone was able to be on the path to receive optimal health, and that is the goal. Looking at the impact of social determinants of health, that looks at your economic, your social, and your environmental factors that go into what makes a person healthy. So let's look into that a little bit more. So in your socioeconomic factors, what are those? Those are your income, it is your job status, it is your education, and that all goes into your socioeconomic status. That is 40% of what makes a person healthy, which is interesting because when you think about what makes a person healthy, you most of the time don't think about your job. I will say that research most of the time shows that when you do look at those socioeconomic factors, the number one that comes to the forefront is childhood poverty. And that is because childhood poverty has such a trickle effect. If you grow up in poverty, you are much more likely to have a hard time in grade school. If you have a hard time in grade school, you have a very difficult time graduating high school. If you don't graduate high school, you have a very difficult time of getting a nice paying job, live in a safe community, and that is that trickle effect. Next is your physical environment. Your physical environment encompasses 10% of what makes a person healthy. Your physical environment is the built environment around you. It's your green spaces, it's your sidewalks, it's your safe community. It is anything that is around you physically. Healthy behaviors encompasses 30% of what makes a person healthy. Those are the choices you make. It's the behaviors you do out in the world. It is if you use tobacco. It is if you vape, use recreational drugs, if you exercise regularly, if you have a strong diet, or if you're having fast food and healthy foods. That all goes into your behaviors. That is 30%. Healthcare. Healthcare only takes in 20%, and that's so interesting. Surveys have shown that if you ask someone, what makes a healthy person? They are going to tell you going to the doctor, getting my regular screenings, making sure that I'm okay once a year. And that's only 20% of what makes a person healthy. It's still extremely important. It's 20%. I don't want to say access to care is not important. But if you look at those socioeconomic factors, almost everything ties back into those. And I will show you because of healthcare. So we live in the United States. Most of the time, healthcare, the gateway to healthcare is health insurance. Most people have health insurance through their employer, so that wraps up back to your socioeconomic. Your socioeconomic, you need a full-time job most of the time in the United States to get health coverage. So that ties into, did you have a college degree? What kind of job can you get? And it ties back into education. Looking at your physical environment. For physical environment, most of the time you can afford safe housing in a safe neighborhood if you have a good paying job. You got the good paying job by having a quality education. It goes back to your socioeconomic factors. And then your health behaviors. That is, if you have a nice paying job, you're able to afford a gym membership. You have access to fruits and vegetables. You have access to a clean, safe environment to live in to work out. So it all really does tie back to those socioeconomic factors. So what can be done as a community? I do see quite a few presentations that, well, this is health equity, these are the inequalities, good luck with it. But I do want to show that there are changes moving forward, and those changes are to working with everyone together. And what are we looking at? How do we achieve health equity? It is shifting from programs to PSE change, and that is policies, systems, and environments. So let's use an example of teens and trying to keep them away from tobacco and vaping and giving education. Now, if we have a program, the program, let's say, is Teens Against Tobacco, and it's a 1-hour educational series for 1 month. And so that is going to be a behavior modification. You're telling them about the dangers of tobacco, why to stay away from it. First of all, telling any kind of behavior modification is extremely difficult to achieve. Even when you have all the education in the world, behavior modification might be one of the most difficult things to tackle in healthcare. It's also time-bound. You're only going to be able to affect the people that came to that program, were able to make the series. It's also short-term. Studies have shown that any kind of program that has education normally lasts about 3 months. The person forgets about it. It's kind of like diets. You need to lose weight. 3 months later, like, oh, I'll be fine. And it's also targeting an individual. Let's say 15 to 20 kids were able to attend the program. It's only going to affect the 10 to 20 kids that affected the program. Now let's look at a policy, system, and environment. So that has a long-term change. An example of this would be in Illinois, outlawing flavored vaping products and also outlawing marketing for teens and children for vaping products. Let's also look at Illinois Tobacco 21. Those are large programs. They are long-standing. The governor signed them. It would be very difficult to get rid of them. They're structural changes. They are ongoing. They don't have an end date. And they also target the entire community. And for these examples, that targets all of the youth in Illinois, or any youth that comes into Illinois. It targets parents. It targets everyone. And so that little change makes a huge difference when you compare it to programs. So this just gives a little bit more of examples of program, policy, and systems. So a program would be a 5K run. You talk about obesity, you have a 5K run. I don't want to take anything away from 5K runs. I think that they can be great. They're a great way to get out and exercise. They're social, emotional, seeing people. They have their purpose, but they certainly aren't going to move the needle on anything. Another example would be teaching classes on how to cook fruits and vegetables. Again, I think that's wonderful. I saw at a local farmer's market where someone was teaching people how to make zucchini and squash. I think that's great. A lot of people don't know how to cook certain types of vegetables. That has its place, but it's only going to affect the people that were there in that short amount of time. If you look at a policy would be keeping PE and physical education in all of Illinois schools, or the Illinois 21 that I brought up, or having ordinances for sidewalks for being able to get to A to B safely. That's a policy that's going to affect everyone, and that is long-standing. Looking at systems, an example of a system would be employers or insurance companies paying for gym memberships to keep people healthy so it's not a financial burden for them. And it's also allowing WIC and SNAP to be used at farmers markets. And that is a targeted systematic change. That is mothers with children who need fruits and vegetables at the home, giving them free access to healthy foods. Environmental changes, like I said, that is your built environment. That is having open community gardens where people can go and they can have make their own fruits and vegetables and grow those. It is also having physical equipment in green spaces. And I will tell you, I've seen so much more of that, where in the middle of a park you see a gym, and my kids ask me what that is, and you have free green space to walk, work out. And so those are also environmental changes. Another example would be sidewalks and ramps that are ADA accessible sidewalks for people that are disabled. Those are environmental changes, and those make the biggest impact. With this, I do want to say that healthcare systems are also looking at this. And this is just an example of what Advocate Aurora is doing, but I will let you know that other healthcare systems are in the same boat looking at the same things. While we do clinics, while we do flu shots, while we are looking at vaccines, the things that when people think of community health, we are still doing a small piece of those, but we're also doing food insecurity, because food insecurity actually it leads to obesity, it leads to a lot of other chronic issues. We are looking at workforce development, because we know that when there's high unemployment rates or people aren't insured or people aren't employed, they're more likely to be unhealthy. We are looking at housing. We are looking at access to behavioral health, community safety, and we are also looking at where people can have access to all health care. With this, I do want to say that health disparities and health equity, they are huge concepts, and there are whole college classes dedicated to even just explaining what health equity is. I took those when I was getting my master's in public health, so this is a very condensed way to describe it. But I do want to say that we can move the needle. It takes decades to make these huge systematic changes, but they absolutely can be made. But it takes a multi-sector, multi-layer approach. And when I say that, multi-sector, it takes the healthcare systems moving in one direction. It takes education moving, our local health departments, our state government, our local libraries, our non-for-profits. If we are all moving in the same direction, we will absolutely move the needle. And again, when I say multi-layer, those programs in the community are absolutely important, and they will reach people, but also looking at that multi-layer of policy, complementing it with screenings, complementing it with environmental changes, and that's how you move the needle forward.